It is very convincing. I can tell you, a guy like Mike Farrell talks about any kind of idea like this that sounds woo at first, and it becomes very convincing. So we shot those videos, and on Monday, this Monday, day after tomorrow, we'll be in Los Angeles again at the White House Western Regional Summit on Healthcare, to which Obama's administration has invited Governor Schwarzenegger and Christy, Whitman or whoever it is from New York, to come, from Washington, to come and talk about all the things they're going to do for us for health care. None of which include single-payer health care, because guess what? This is an event by invitation only, and guess who does not get invited? Me, or any of the people I know. So we're going to be outside with another 1,000 people or so from California nurses.
Clear on how to make sure I get on the list to get the videos. How do I do that?
Go back to Sherry and she will tell you. She will put you on. You will send a fax to Congress, and as part of our sneaky plan, and when you send a fax to Congress, part of our sneaky plan captures your email address so that you are forever and ever in our grip. Also your zip code, so that, by the way, you also can become a member of the Cyber March on Washington. We're hoping to have 1 million avatars descend upon Washington on May 30th, I think it is. And so you can choose your avatar and descend on Washington from your zip code. Anybody else? By the way, this is a brand new mechanism for political action. Nobody has put this together before. It uses a technique of embedding hyperlinks in a video. You can click on the hyperlink in the video that will take you directly to the page with the facts. You then enter your name, address, or your name, your email address, and your zip code, hit the submit button, and that immediately sends a fax, which of course, in the tradition of all activist organizations, also kicks you then into the donation page. But you can skip that. Anybody else? Yes, sir.
So by doing the videos, we'll answer all the questions we have about single payer, healthcare, and stuff like that.
Say again?
If we go to this source, they also have information.
Yeah, the website that this fax is on has a lot of answers about single payer video. I would recommend, there's one called the Easy Answer video. It's on the right, the Easy Answer video. The Easy Answer video is a video that some guy put together that explains why single payer healthcare works. And the notion basically is, look, it's like a prom committee. You know, you go to the prom, it's not, everybody doesn't hire their own caterer, everybody doesn't hire their own band. No, you have a prom committee. The prom committee hires the band, hires the caterer. They take the money from you, they take the money and give it to the caterer, give it to the band. Everybody has a good time, nobody has to negotiate their separate rates. That's the same idea, We're asking that the government become the prom committee, and we pay the government, and the government negotiates rates with everyone. Instead of having 1,200 different insurance companies with umpteen thousand different plans each of which every single doctor in a hospital has to negotiate with separately, and you too have to negotiate with separately. Instead of having that multiplicity of payers, we have a single payer, so that red tape is cut. And the fact is that doing this reduces the total budget of healthcare costs by 31%, which in this year amounts to $800 billion a year.
Did you say $800 billion a year in industry?
No. The healthcare amount, the amount of money spent on healthcare in this country is $2.4 trillion, and this year, or last year, I guess. And 1/3 of that, essentially, is spent on handling the administrative costs of dealing with a multiplicity of payers. Medicare, the program that handles the administration of money paying for guaranteed health care for seniors, has a 3% administrative cost. The cost for our multi-payer system is 31%. Could save some money. Yes, sir?
What are the biggest obstacles to single payer?
The administration and the Congress, in that order, or vice versa, maybe. Oh, and the insurance industry. But actually the insurance industry has, the insurance industry has decided that they have to get on board. The health insurance industry about last year sometime began to discuss becoming advocates for health reform. And they want health reform too. In fact, they're all in favor of single payer, as long as they are the single payer, right? If the health insurance industry gets what they want, there will be no public plan. There will be no ability for anyone to choose anything other than buying an insurance plan from a for-profit company. So for instance, one thing they're asking for right now, they're saying, this was about a week ago, they sent a letter to Congress saying, oh, you know what? We will stop charging exorbitant premiums for sick people if everybody is forced to buy insurance. Now, I read into that. We will stop charging exorbitant premiums to sick people as long as we can charge everybody exorbitant premiums. Hey, good deal. And that's what they want. They want to eliminate the possibility that anyone is allowed to have health care through any other mechanism than their mechanism.
What's the difference between the Obama plan of everyone can buy the same insurance that the legislature...
The Federal Employees Health Benefit Plan. Obama's plan suggests that everyone can buy the Federal Employees Health Benefit Plan. The Federal Employees Health Benefit Plan is basically a group that contracts with insurance companies around the country, usually Blue Cross plans. So that if you're a federal employee, you can choose to pick your insurance from one of several plans within the FEHBP. What is the difference between buying into the Federal Employees Health Benefit Plan or buying into a private insurance plan through an employer, through yourself, through whatever? The difference is that the FEHBP gets screwed worse. They pay $14,000 a year per person, per insured person, for a Blue Cross plan that in the same locality and in the same range of personal health charges $12,000 a year for everybody else. So that's the difference. The difference is you would pay more. Great deal, huh? Yes.
I actually teach health and economics here.
Yes.
And one of the biggest concerns that my students have when we talk about single care, because of the amount of money that's allocated to the health insurance companies, especially right now, is what happens to all those jobs.
Oh, yes. There are something like 130,000 jobs within the insurance industry itself. And then there are all those people that work as billing clerks in hospitals. So for instance, Duke University Hospital has 900 beds, and it has 900 billing clerks. That's more than the number of nurses it has. Anyway, what happens to those jobs? Well, good question. In HR 676, which is Conyers' bill that is named National Health Care Act Expanded and Improved Medicare for All. That's a mouthful. HR 676. That bill says everybody who loses their job as a result of this bill, everybody who loses their job in the health insurance billing industry as a result of this bill will be paid their full salary for 2 years up to $100,000. I can't understand why we're not paying the CEOs their $23 million salary. I just can't understand it. And I guess that they are just going to have to settle for $100,000. Dang.
So how much money would it free up for corporations? What's the incentive to the corporation?
Under the present system, the average cost of medical care to a corporation is about 10% of payroll. Under the system in which Medicare for All is the only payer, it is funded by a payroll tax of a total of 9%, 3% of which is paid by the individual, 6% of which is paid by the government, the employer. And so 6% of payroll is less than 10% of payroll, right?
Yeah.
Now, the reason that works is because it covers all employers. including the guns.